in order to have the informatics infrastructure for advanced practice nursing, we need the evidence for our interventions and our understanding of patient problems being brought into the nursing practice. So we begin at the very bottom of the screen with the idea of nursing practice and nursing science. That drives the kinds of informatics tools that we need. This central box here are the informatics tools that we need: data processing and modeling, database design, standard languages, there's that awful word again, delivery devices, human-computer interface, data storage, data retrieval. You could look across this central box and say that is the crux of what we're going to focus on this semester: translation of the evidence of nursing through informatics science solutions, which should then lead to actionable knowledge and practice that addresses that is implemented at the point of need. And understand the points of needs and targets in my purview are largely patients and family caregivers, but in Pam's purview might be community or interdisciplinary team members. In Amy's purview might be the nurses that she practices with. The challenge that advanced practice nurses face is right here in this ball. We have to be able to implement these information technology solutions at the point of practice, but they need to be available, they need to be technologically sophisticated, and they need to be drawn from the basis of our practice. Using this as our guide, we will spend the next 6 weeks intensively studying what is happening in the technologies that are going to be able to guide the practice and guide the solutions to the care challenges that you've identified. But I want to call your attention to these three phrases. Informatics focuses on information structure, information processes, and information technologies. The components of nursing and health informatics fundamentally are information structures, information processes, and information technologies. And we're particularly interested in those that support the domain and practice of nursing. Now, I separate domain and practice here for a really good reason. Most of you work in interdisciplinary environments, so exclusively supporting the domain of nursing would be insufficient for the advanced practice nurses' needs. There was a question on the text that just came up that said, that is asking if the model is much different from the foundations of knowledge model. The difference between the foundations of knowledge model and the model that I presented to you a few minutes ago is that the model I presented to you a few minutes ago has a focus on targets in the practice environment, whereas the foundations of knowledge model that is in your textbook focuses a little bit more on the individual nurse acting on the knowledge. They're conceptually similar, but they do have some slight nuance differences. Okay, information structures. What are these? Well, there we are with those terms again, ladies. I'm sorry to tell you, but they're going to keep coming back at us. Common terms: computer recognized parts of speeches. What are nouns? What are verbs? When we're putting together computer generated text, and then some of you talked about your experiences using dictation. Know that the text processing is a not insignificant challenge. Rules for combining the terms, we call those grammars, but there's a host of information structures, vocabularies, grammars, and storage rules. These next week, we'll spend a little more time going into next week, and I guarantee you you're going to find this terminology thing a little more interesting than you did before you came into the course. Information processes are pretty similar. Capture, storage, and retrieval we've gotten pretty good at, but synthesizing and interpreting or communicating and transmitting for practice, that's where the demands from practice have to drive the technological developments. And then finally, information technologies. Now we're going to focus a little bit, not a whole lot on the specific devices, but you will leave here knowing a little bit more about what's the difference between networks and clouds. And when you see that commercial about we're going to the cloud, you'll know what they're talking about. The role of sensors in both household as well as institution-based information processing is becoming very, very, very big. Smart cell phones and intelligent devices, smart clothing, aware households is looming in the future with the possibility of bringing health everywhere and making sure that we have the technologies to do this. But you're going to be addressing two important things this semester. One of them is, how can nursing informatics support advanced practice nursing? And you should leave this course with the ability to answer that question. How can nursing informatics support advanced practice nursing as you know it? Your practices are all different. It's going to be a little different at each time. But you're going to have to leave the course with a little bit of responsibility also. What are the APN's roles in acquiring and ensuring nursing and health informatics innovations? I believe you're not going to get without giving, and so I want you to be able to articulate what do you need, but I want you to be able to explain it in a way that helps others understand so that they can build for you the tools you need. So I want to spend the last couple slides talking about the content that we're going to be reading and focusing on over the next couple of days to prepare you for what is the advanced practice role in acquiring and learning this. Now, there's three things that advanced practice nurses need to be able to do to support innovations. The first thing they need to be able to do is to model practice events, encounters, and episodes from the advanced practice nursing perspective. Model practice events, a single intervention. Practice encounters, a visit to the NP, to the stay in the hospital. Episode, the phase of care challenge that the person is experiencing, whether it's like my son who broke his arm and it took 6 weeks to heal and then he was fine, or the 27-year-old person who gets diabetes and now has diabetes for 60 years. The episode of care addresses a different aspect. In order to do this, advanced practice nurses have to start off with what are the dimensions of advanced practice nursing. That's where you begin. Nobody else is watching your back around your practice arena except you. So you begin, and I recommended some of you that if you don't have an advanced practice nursing text or general reference text for the Doctor of Nursing Practice, this is the time to get one. Get the one that makes the most sense to you, but you want to be able to have one that helps you keep thinking about what is the role. There's lots of people looking at staff nursing and nursing informatics. Hardly anybody's looking at advanced practice nursing and nursing informatics. You've got a big job here. We're going to be observing actual situations, but then you have to document them in a form that communicates the practice nuances to those designing the solutions. And that's what the next step and the next slide is for. We're going to use a structure for modeling practice called SEEPS. SEEPS is a center here on campus for patient safety, the systems engineering applied to patient safety challenges. On the slide in front of you, and this slide is on the website, and you're going to see this several times, you see a box that we call the work system. And you see a row across the top that should look really similar to those of you who started to look at quality improvement, the structure, the process, and outcomes of care. We define the structural aspects of care as the work system. We define the process as the care process, the nursing interventions, and the outcomes focused on employee level as well as patient level. And the two curved arrows denote a feedback loop. But let's spend a little time in this box. When we try to study and model practice situations, we're looking at generally some kind of a task. Now, in nursing, task has a bad name, but I want you not to worry about that framing of it, because in an engineering approach, task simply means what is the work that's being done? What are the behaviors, the activities, the cognitive processes? It is not a diminution of there's no intellectual work here, but rather it's a descriptor to define the domain. What work are we trying to do? By whom, the person, in what physical environment, governed by what organizational rules and policies, procedures, state laws, etc., employing what tools and technology. Now, you're going to be reading the Carry On article this week, so you'll get a better, deeper understanding of this. But as you start to model the practice arena that you want to understand, having a framework to hang things on is going to help those that you're trying to communicate to understand it a little bit better. Ooh, that sounds a little like standard terminology, doesn't it? But we're not going to use the standard terminology just yet. I want you to think about this. I'm proposing this as a strategy to help you organize the way you analyze informatics problems. Advanced practice nurses also need to participate in something that's called the Systems Development Life Cycle, or SDLC. This is a process that every information system, every work system goes through. And if you'll note, it's not clear where it starts. Sometimes a computer system gets implemented because somebody went to a conference and got a good idea. They brought it back without thinking, was it designed for us? Is it solving a problem? Other times we see a systematic start at the planning process here. In the systems development life cycle, and sometimes you'll see 5 units and sometimes you'll see 6 units, the steps generally flow through a system is planned, a problem is understood through a planning process. The depth and the components of good characteristics of solution are generated through an analysis process. A solution is designed and then implemented, and then the solution is maintained and evaluated. That's why that maintenance one is yellow, because it implies both sustaining a system and making sure it's working. If it's working well, the system stays in the maintenance phase. If it's not working well, we move back into the cycle. Advanced practice nurses have a role in all of these elements, and we'll be returning to this picture later in the semester as we talk about design and evaluation of systems. I'm going to leave you with an enumeration, not a solution, but an enumeration of what some of the contemporary issues are in nursing informatics right now, because I'll be having you engage with me over the semester and working on these. Meaningful use of health IT is a phrase that has gained a lot of popularity recently because Medicare, Medicaid, the CMS is going to be compensating institutions and practitioners based on their ability to demonstrate meaningful use of health IT. A big challenge, change in the technological forefront right now is the difference between an integrated hospital information system like Epic and a highly distributed information system like APPS. I'm not going to require that you tell me, but my guess is many of you have smartphones or maybe Palm Pilots that have at least Hippocrates on them and probably a couple other decision assistants for work. This idea of moving platforms back into the, moving applications onto platforms somewhat separate from the data that they operate on has gotten a lot of advanced traction, advanced acceptance in the last few years. It totally changes the game of clinical information systems and building a chain of evidence and trust, and opens new questions about privacy, security, and technology, and also about the concerns of the digital divide. Scope of practice issues are actually influencing the informatics agenda in a very big way right now, and we see this in some very positive ways, such as I've been talking to you about the last 10 minutes, to expand the ability of nurses to actually carry out new kinds of practice activities based on new kinds of practices. But we also see attempts to constrain practice and to inhibit nurses' access to information systems that might actually allow them to practice in what appears to another discipline to be an encroachment on that discipline's work. So understanding your scope of practice and your legally protected practice is going to be very, very important as we begin to design information systems. And finally, the guidelines for practice, and I had you obtain those for the ANA scope and standards of nursing informatics practice so you can begin to understand what you can rely on other nurses and experts in nursing to guide you in your work. So that concludes my formal presentation for tonight.